All right, parents, listen up. This is a very hot topic that we debate all the time. There is stunning new information from Mount Sinai that suggests that children whose mothers are exposed to certain environmental toxins during the first trimester of pregnancy have a much higher risk of developing autism.
Yeah, let's dive in and get specific here. We're joined this morning by Dr. Manny Alvarez, managing editor of FoxNewsHealth.com, and psychiatrist Dr. Keith Ablow. Nice to see both of you this morning.
Morning.
Nice seeing you.
Really interesting report this week. We've heard different conflicting reports over the past years about what the causes of autism are. In this report specifically, in the first trimester, there are some startling factors: lead, ethyl alcohol, methylmercury, and other environmental factors that could cause this, right?
Look, this is the study done by Dr. Landgren, who is a great scientist here in New York City. Really looks at many studies that have been published linking developmental delays when it comes to toxins. And we know for sure that many papers have been published. Let's take valproic acid, which is a medication that we use sometimes in early pregnancy for patients that have seizures. When you look at patients that have been exposed to that drug in the first trimester, they have an 11% increase in autism. So for sure, as the embryo develops in the first trimester, as that brain is developing, if you expose it to excessive toxins, like the ones found in, let's say, shampoo or makeup and things like that, it could have the potential effect of creating autism.
And see, that, I think, is the major headline,
Right.
because you don't just have to be exposed to lead
Right.
or to taking
Right.
ingesting some sort of medication. It can be in your hairspray that we all use, in your shampoo, all of these phthalates.
Yeah.
That's the connection.
Look, a couple of I think it was last year, there was a study published where they looked at the urine of pregnant women looking for phthalates, which are things that you find in plastics and makeup, and high proportion of pregnant women had this chemical in their urine. When you look at the outcome of those pregnant patients, again, a high increase in developmental delays and behavioral problems in those children.
Let's bring in Dr. Keith Ablow now to talk about this. Your take on this report that came out.
Well, here's the thing. Dr. Landrigan's paper that looks at previous studies makes it clear, as Dr. Manny has said, 11% of the women exposed to valproic acid, 1 in 10, more than 1 in 10 of these women have kids who are autistic. Now, it couldn't be the fact that there's no potential toxic relationship between substances in our environment and autism if you can induce that kind of rate of autism in people who take this during pregnancy. Now, another thing, listen, as a psychiatrist, I can tell you, people with autism, they have trouble paying attention to things, warming to people. They like to focus their attention on moving objects and so forth. Look at the huge rise in ADD that we're noting. And so some people argue, no, you're just finding more of these cases. The population is more sensitive to it. I agree with Dr. Manny that we really have to look now at environmental toxins and probably urge women use phthalate-free products.
Okay, but before we get off Dr. Ablow, let both of you respond to this. There was, of course, a lot of concern whether or not these vaccines over the past number of years, these early vaccines that we were given to kids, were a problem. Dr. Ablow, take that first. Now, that has been thrown out. We don't have to worry about that anymore?
Look, the study's been withdrawn. This is a bit of the global warming, if you will, of autism. No, people should get their kids vaccinated. There is no realistic and credible data now that supports that idea.
And Dr. Manny?
No, I agree. And the whole issue of this paper is to tell you that autism probably develops in the womb. And, as that brain, as that pregnant patient is being exposed to these chemicals, especially in the first and second trimester, by the time the child is born, you already have the factors that as the child gets older, basically can develop autism.
And so for people who have young children, as I do, should we now stop using the phthalates in hairspray and shampoo? Is there still damage being inflicted, even after the womb?
Look, that's a bigger question. I think that the argument that our society is being overexposed to chemical, I think is a reality. We're going to have to come, a lot of oncologists are looking at papers like this, and they're saying, wait a minute, we're also seeing high rates of different kinds of cancers that we never saw before, so perhaps this could be also a reason to kind of cut back and get a little bit more chemical-free.
Phthalate-free, they exist. Dr. Manny, thanks so much. Dr. Keith